Dental care is essential for having a healthy horse, so we'll go through a few things. First off, the teeth. We have the incisors, which are at the very front of the mouth on the top and the bottom. They are used for cutting the grass from the ground. Then you have the molars, which are used for grinding the grass or other feeds. And they're broken up into two sections. The first three molars on both the top and the bottom are called the premolars, and the last three on both the top and the bottom are the molars. The canines are generally found only in males, however they have been found in females too. They sit right behind the incisors and before the bar of the mouth. And then you have the wolf tooth, which is a tiny little tooth that sits up in the very front of the premolars on the upper jaw. If you have a problem bitting your horse, or if they're throwing their head and generally being nasty while you're trying to ride a young horse, check for a wolf tooth. That could be the culprit. Now, one thing you need to know here is that a horse chews in a circular motion, not in an up and down motion like a dog or a human. They chew in a circular motion, grinding across the top of each set of teeth. This is important to know because of how their teeth can grow and be affected in different ways. Now, the other thing you need to know is that horses' teeth grow all of their life. If you've ever noticed or tried to age a horse, you will notice that a young horse has very short incisors. They're very small, and by the time you get to a 20-year-old horse, they're very long and large. Okay, so having known that their horse's teeth grow all of their life and that they chew in a circular motion, there are different things called malocclusions that can impede that circular motion and make chewing difficult. So things that can happen are points or cingulae, and what this is there are very sharp points on the outside of the teeth on the top jaw, so this is closest to the cheek, and on the lower jaw it is on the teeth side closest to the tongue. So these points get very, very sharp. They can rip ulcers into the cheeks and the tongue of the horse. They can make chewing and eating very uncomfortable and make a horse so that they don't even want to eat. Hooks can be nasty little creatures. And as you can see from the diagrams here, you can have what's called a caudal or a rostral hook. And the caudal is on the lower jaw at the very back of the tooth, of the set of teeth, and the rostral is at the very front of the upper jaw set of teeth. They can also happen at the back of the incisors on the tops because their teeth don't generally line up perfectly. A wave mouth. So a wave mouth is where the teeth don't grow evenly. This generally happens in young horses because as horses go from babies into adults, they lose their baby teeth or caps, and then they grow in their permanent teeth just like children. And if those caps are not broken off or fall off in the appropriate amount of time, they can wear away the opposing tooth, making that one shorter than what it should be and giving the mouth a wave appearance. A step mouth can happen if a tooth has been missing. Then the opposite tooth will continue to grow unopposed, and that means there's nothing there to keep it worn down. So you'll have a tooth that will just keep growing and growing, looking like a step. Now, a ramp mouth generally happens when a wave mouth has gone out of control. There's no one ever been to check your horse's mouth. They had a wave as a baby, and by the time they're 18, it has grown into a ramp, where the teeth that were a little bit taller are now extremely tall, and the opposite ones have been worn down to the gums. A parrot mouth is not actually a malocclusion, it's a conformational problem. However, it is where a horse will have an overbite. This makes eating very difficult because they need those incisors to cut off the grass. I have some photos here. The first one on the top left is a rostral hook, a nasty one. You can see how if left to its own devices and never being floated, that could potentially grow so far as to poke the bottom gums while the horse is eating. Very painful. The middle one on the top is uneven incisors. And the incisors need to be floated as well to keep those even, and that way a horse doesn't have a smile or a frown or uneven incisors like this. We want to keep them nice and level, straight across, and that way the horse can easily bite off the grass. Over top right, that is a parrot mouth, and you can see why it would be difficult for a horse to eat with that. Bottom left shows a wave mouth. You can see where the front 3 molars have been worn down more than the back 3. And the bottom right shows a step mouth, a pretty severe one on the right side, and then a wave mouth on the left. Just because they have one on one side doesn't mean they don't have something else going on the other side. So what do we do about these things? Well, we do what's called a dental float. On the top left you see the tools used for a hand floating, in which the veterinarian or dentist will put those in the mouth and manually file down those points, hooks, or other malocclusions. At the bottom there I have a photo of a power float. This, again, by its name, uses power. You plug it in, generally done in a clinic somewhere, so that you have power and plenty of light. And it's kind of like a drill. You press the trigger and that bit at the end will spin fast, and it will take off the points or the hooks or whatever, because it has a bit usually made out of tungsten or carbide, so it's a very tough bit. And what does a float do? Okay, so the goal of a float is to round off any points or hooks that are cutting into the cheeks or gums, to even out a wave or a step mouth. Now, depending on the severity of the wave, step, or ramp, this may take several floats over several months or years to even out. You want to even out the incisors again so they can bite off the grass. And you can take off some growth off of the canines to make it easier to bit your horse. If those canines have grown pretty tall, it can be a little difficult to put a bit in over those canines, so you can take those down as well. This shows a photo of a step mouth, and before and after, the before at the top left and after at the bottom right. As you can see, the wave was not completely taken out on the left, and the step was not completely taken out on the right. This is a case of taking several months or even years to fix. So when do you float? Well, vets prefer to get their first look in your horse's mouth at 2 to 3 years of age. Well, you ask why. They're young, they should have good teeth, right? Well, the thing is remember I told you that they have caps as they get older and they grow in those permanent teeth? Between 2 and 3 years of age, those caps start falling off at different times. And actually, some of those caps can fall off as late as 5 years old. So if your vet is getting a look in there at 2 to 3 years of age, and they see that your horse has a retained cap, they can pop it off to prevent a wave mouth. Or if they're starting to get a wave mouth already, they can go in and just use float and do a minor adjustment and level out those teeth to prevent a further problem like a ramp mouth down the line. Every horse should have a routine dental check every year. Now, what is a dental check? Basically, when you go to get your vaccinations, or you go in for x-rays or a lameness check or a fecal exam, any of those things, anytime you go into the vet, at least once a year, you should have the vet just take a peek inside the mouth. At this one time a year peek, he can tell you whether or not your horse has a problem. If he looks sharp, he can take those sharp points off, you're good to go, and your horse will eat well all winter. If they've got another problem like a wave or a ramp or anything like that, then they can get that taken care of for you too, and then you know how often you need to get him in to get it completely fixed. That horse may not need anything at that time, and your vet will say, nope, great teeth, go on and we'll see you in another year. But every horse should have a dental check every year. So routine floats, when do they generally happen? Well, babies usually should have a routine float, sometimes not, sometimes they just do great on their own, but between 2 and 6 years old, they'll probably need a routine float. just to make sure that nothing is, that it's all level and neat. And then about every 1 to 3 years, a horse will probably need a float during the years of 6 to 15. As long as you keep up and the vet knows what's going on in their mouth, they can generally, do pretty well from 6 to 15 years old. Now, once a horse gets past 15, they generally need a float every 6 to 18 months. Depending on whether or not that horse has had his teeth taken care of as a young horse or not, they may need a lot of work every 6 months, or maybe they can go every 18 months and they're just doing it that often because they're getting sharp. So what are the benefits of floating your horse's teeth? Well, if you float them from the time they are young all the way through their life, they're going to keep solid, even teeth through their entire life. With floated teeth, you're not going to have any ulcers because they're not sharp. That top left picture shows you a nasty ulcer because that horse had some very sharp teeth in there. And obviously it was painful to the horse. He's probably losing some weight as well. The bottom picture shows the teeth of my 20-year-old gelding. He's had his teeth taken care of since he was a baby, and the vet says he's got the teeth of a 12-year-old. I'm pretty proud of that because they're all solid. There's nothing loose in there. He doesn't have a wave or a ramp or anything, and said he's going to have really good teeth, which means he's going to be, this will prevent weight loss because he'll have good teeth to eat with. It will prevent head tossing and bitting issues because his teeth are in good shape. When you take care of your horse's teeth, you are preserving the longevity of your horse. No teeth, no horse. So if they can't eat, you can't keep weight on them. They're no good to you. So with teeth like my 20-year-old gelding down there, he's going to be able to be used for several more years. And yes, I do use him. My daughter rides him. And it's cheaper in the long run. You can spend your money on these floats however many times in a horse's life that they need them. But if you don't take care of them and you end up having to feed your horse senior feed, that can get very expensive very fast. If a horse doesn't have any teeth and needs to go on senior feed, that's $20 a bag. And generally a horse will need anywhere from 9 to 12 pounds of senior feed a day. So it can get very, very expensive. Alright, so what does floating entail? Usually they have to sedate your horse because I don't know of any horse that tolerates having their teeth floated while not being sedated. The speculum, as you see in the picture, is a device to hold the horse's mouth open. Sometimes they have lights in them, sometimes they don't. This way the vet can easily get in there to get those teeth without worry of getting their hand or the float bitten. Then they float the teeth with either the hand float or the power float. And then the horse must recover. You don't want them to eat or drink before they're fully recovered because they can choke. Generally a floating will cost anywhere from $75 to $200. Most of the cost is your sedation. The cheaper end is going to be your hand floating, whereas your higher end is going to be your power floating. So who can do a float? Well, there are two types of people who can do a float, a veterinarian or an equine dentist. However, with an equine dentist, you must know your state's equine law. In the state of Wyoming, it is unlawful for anyone other than a veterinarian to administer sedation. So an equine dentist can float your horse's teeth, however they cannot sedate your horse legally. Therefore you need a veterinarian on hand. Most people just prefer to have their veterinarian do it because then they don't have the double cost of the dentist and the veterinarian.